I try to make videos in between sessions, and then that means there's like a time window, and inevitably I take too long, and then I like don't have figured out how to like pause and like put together two videos. So then I redo the whole thing. So let's see. This is gonna be about this very cool article that I found about autistic meltdowns, and it's on the website Reframing Autism. I'm going to put the link in the description, and maybe I'll get through it, or maybe I'll do this four more times. So I loved this article primarily because they call an autistic meltdown an autonomic storm. If you don't know what an autistic meltdown is, it's something that really can happen to a lot of us neurodivergent folk. You don't have to have an autism diagnosis to have a meltdown. But it's sort of known in the autistic community. And the biggest message here is that an autistic meltdown is not a choice that someone makes. It's not um manipulative, it's not intentional, it's not something that they can stop or pull out of, and it's not something that they choose to do. So that's the most important message to me, and that's why I love calling it an autonomic storm. Now, I looked more into the phrase autonomic storm, and it turns out that it also is used in the medical community to refer to something that I can't pronounce. Autonomic storm. Let's see, what was it called? Um, para paroxysmal sympathetic hyperactivity, and that is like a sudden and severe overactivation of the sympathetic nervous system. That is basically like the sympathetic goes into overdrive and takes over the system. They describe that as increased heart rate, high blood pressure, sweating, fever, tremors, muscle spasms, pain, confusion, or agitation. And that is not quite autistic meltdown can turn into that, like on the severe end of the spectrum. But sometimes what you're catching is like a little bit before that, and it could include crying, wailing, sobbing, screaming, throwing objects, breaking objects, flapping or pacing, clenching or grinding teeth, running away or eloping, as it's often called in school systems, hitting, punching, biting, kicking, or pushing of objects, oneself, or others, intense stimming, rocking, vocal stems, muscle tensing, joint cracking. So that those are all like the sympathetic chain of things. So that would be in the category of like the autonomic nervous system goes into the sympathetic response. And then on the other side of things, shutdown, which they do include some characteristics of under the category of meltdown in this article. Shutdown is the other side of the autonomic nervous system, which is the dorsal response. And so that looks like fainting, vasovagal syncope at its extreme, and then also like withdrawing or shutting down, zoning out or disassociating, unresponsiveness when you call their name, things like that. So both of these things could be happening simultaneously, but most often we're going to see more of a sympathetic, which is like that mobilized response, or a dorsal, which is the immobilized. So these can last, anywhere from a few minutes to an hour or longer. And it really depends on the individual and their nervous system capacity at the time. And the big focus for me here is that this is autonomic. It's happening without the person's conscious control. It's their nervous system saying, the threat is so severe that we're not going to make choices. We're going to cut off from the frontal lobe, and we're just going to put you into a severe, fight flight response. And people often try to calm people down here. And they do a lot of talking. And if you are cut off from your frontal lobe, then you're not going to be able to process language. And it's actually going to be more confusing and more upsetting. So I'm going to point you in the direction of the meltdown protocol, which I learned from Corey Andreas, which involves the seven S's. And I will put that link in the description as well for how we interact with on autistic meltdown. The really short answer is like, don't use language, right? Stay calm yourself. So, the first advice that I encourage folks when they're in the presence of someone having an autistic meltdown or any kind of autonomic storm, that you check in with your nervous system, that you stay quiet, that you take care of your own nervous system, that you move slowly and calmly, you give them a lot of space, and you don't touch them without their permission. Now, if someone's meltdown includes hurting someone else, it can be great to just get that person out of the way. So we're not going to ask the person in a meltdown to do anything because they're not in their choice making part of their brain. So we're not going to tell them, like, stop hitting me. We're not going to tell them to remove themselves because they don't have access to their choice making part of their brain. We're going to clear the area similar to how you would do if someone was having a seizure. Okay, so when someone's having a seizure, you're not like, stop biting your tongue, don't choke on your vomit, for example. You're going to turn them on their side so that those things don't happen. And you're going to clear the area around them so that nobody else can get hurt and they can't hurt themselves worse. So you could do similar things when someone's having a meltdown, get other children out of the way, get other adults out of the way, get, like, furniture, breakables, etc. So, why do these meltdowns occur? It can be a variety of things. Overall, we're gonna say the nervous system has, reached its capacity. So all these things stack up on each other. Sensory, um, sensory stress, disruptions in routine, lack of sleep, life changes, co-occurring mental health conditions like anxiety and depression, hormonal changes, medication changes, chronic pain, illness, or other disability, reactions to new medications, lack of perceived control or autonomy. Um, every aspect of the senses, so sounds, touch, visual, smell, taste, and movement. So any kind of like vestibular impact, and could be cognitive stimuli, so too much information to process, or anxiety around perceived overwhelming experience cognitively. Leading up to a full meltdown, you're going to notice things like increased stimming, fidgeting, rocking, pacing, um, a decrease in language skills, extra sensitive to sensory input, becoming easily frustrated or irritated, withdrawing from things that one normally enjoys, and having more repetitive behavior. So, all of this to say is that we don't want to interrupt or stop the meltdown. What we want to do is notice what happened leading up to the meltdown. Notice what needs have not been met. A lot of times, this is going to be pain or a lack of autonomy or just an overload, right? It was too much. Something was the straw that broke the camel's back. We're not going to try to stop or tell the person to stop their meltdown. We're going to support them quietly. And then we're going to do our self inquiry and our research on what was going on before this. And we're going to work on reducing the things that would tip somebody into a meltdown as best we can, and accepting that for a lot of folks, this is going to happen at various times throughout their life just because they have a nervous system that is wired more sensitively to stressors. And so autistic meltdown is more likely to occur. And how can we build a life that makes space for that? Okay, I love you so much. And I'll put the link to the article and the seven S's in the description.